The novel coronavirus started on the 17th of November 2019 in Wuhan, China, and is presently referred to as COVID-19. It is a disease caused by a new strain of coronavirus. CO implies corona, VI implies a virus, and D means disease. The virus that causes COVID-19 is in a family of viruses called Coronaviridae. The World Health Organization announced the COVID-19 outbreak as a pandemic on March 11, 2020. A variation is a virus that differs from the original virus in at least one way. Virus variations can emerge from time to time. Viruses, such as SARS-CoV-2, evolve throughout time and will continue to evolve the more they circulate. Some coronavirus variations, such as Delta and Omicron, are easily transmitted between people. The coronavirus is a respiratory virus that spreads primarily through droplets generated when an infected person coughs or sneezes. The virus can also spread in crowded and/or poorly ventilated indoor spaces where people tend to spend longer periods of time. This is due to the fact that aerosols can linger in the air or travel beyond conversational distance. This is often called long-range aerosol or long-range airborne transmission. The survival time of the virus on surfaces depends on a number of factors, including the type of surface, temperature, relative humidity, and specific strain of the virus. People can also become infected by touching their eyes, nose, or mouth after coming into contact with virus-infected surfaces or objects. The majority of those infected with the virus will have mild to moderate respiratory symptoms and will recover without the need for medical attention. Some, on the other hand, will become critically unwell and require medical assistance. Serious sickness is more likely to strike the elderly and those with underlying medical disorders, such as cardiovascular disease, diabetes, chronic respiratory disease, or cancer. COVID-19 can make anyone sick and cause anyone to become seriously ill or die at any age.
Ay, tulog na mga bata. Makagawa na rin ako ng tahimik.
Ate, labas tayo. Wala na si Mama.
Hindi pwede. Baka mapagalitan tayo ni Mama. Saka, di ba, bawal raw tayong lumabas.
Hindi. Magfi-face mask na lang tayo tulad nung ginagawa ng iba. Tara na ate, matagal na tayong hindi nakakalabas eh. Ate, laro na tayo.
Sige, sige.
Ang daming trabaho sa hospital. Pagod na ako, tsaka inaantok na ako, Bi.
Ay naku Mare, magpahinga ka na para may energy ka ulit bukas.
Okay, sige. Pag mag-ice cream muna ako kasi syempre masarap pag-ice cream na yun. Init kaya, Bi.
Kaya naman po eh. Pero alam mo naman, ang sarap kasi ng ice cream.
Yan, sige, ice cream ka pa. Tahoy, baka akin kinain mo, naku, ikaw ka talaga. Huyo ka sa akin.
Ha? Secret.
Hala, uy, mga kapitbahay natin mga chikitin. Tagal na natin hindi nakikita. Tagal natin hindi nakikita.
Ay, hello.
Hello!
Hello po!
Hello po! Uy, takbo kayo ng takbo baka madapa kayo.
Ikaw naman. Hayaan mo na, minsan lang naman eh. Tsaka mga bata yun, no, Diyos ko. Minsan na nga lang mga nakakalabas.
Eh bakit ba? Ayaw masaktan yung mga baby ko na yun eh. Tsaka minsan na nga tayo magkita. Diyos mio to. Oh, buti nakalaro kayo. Ang tagal nyo nang ginagala ko sa labas ha.
O siya. Huwag kayo masyado magpapakadilim dito ha. Umuwi na agad kayo.
Apa. Ingat po kayo.
Bakit po? Ay, maghugas tsaka mag-alcohol kayo pagpasok niyo ng bahay. Huwag na kayo magtagal sa labas ha, kasi masyado ng delikado. Okay? Bye!
Sige, bye-bye.
Teka lang, bunso. Napawing ako.
Erlyn, Tin!
Mama!
Magsipasok kayong dalawa dito, pinapatulog kayo, di ba? Sinabi ng bawal lumabas eh. Pag kayo nagkasakit, wala akong pang-hospital sa inyong dalawa eh. Maraming
Papasok
salamat
na
eh.
po.
Would get a ride in that engine that could go. Batman robbing it, bang bang cocking it, Queen Nicki dominant, prominent. It's me, Jesse and Ari. If they test me, they sorry. Riders up like a Harley, then pull up.
Gab!
Ay, anak ni Rahel.
Akala ko ba masakit na lamunan? May wait kumakain ka naman ng ice cream.
Papalimbig akong init kasi. Bakit ba? Gab, bakit ba ayaw mo kong paalisin ng bahay?
So ito na nga, nag-positive kasi ako sa antigen test namin kanina. Itong best ko pa inulit.
Ha? Paano mangyayari yun? Eh, wala ka namang sakit, di ba?
Ibig sabihin lang no, asymptomatic patient ako ng COVID-19. Kaya kailangan yung antigen test kita ngayon para malaman natin kung positive ka din ba o hindi. Kaya pwede sa mga kumain ng ice cream, Diyos mo yung babae ito, napatagalalo.
Naku, pag sinasabi ko talaga sa'yo, pag ako nag-positive, ikaw may gawa ha?
Perfect nurse ako agad. So ayun nga no, yung paglakad na ng lamunan ay sintomas na meron kang COVID-19. So ibang mga sintomas is lalabas pa ng ilang mga araw. Positive ka. Pangalawang beses na tayo nag-antigen test and both are positive.
Ano pa gawin natin?
So, nasabi naman ako sa ospital namin na 2 weeks ako hindi papasok. Bilang nurse, alam ko naman yung dapat natin gawin at kung kailan dadalhin sa ospital. Kaya ako ka mag-alala.
The interval between being exposed to the virus and becoming infected with COVID-19 is called incubation period. On average, it takes 4 to 6 days for symptoms to appear. The difference between symptomatic and asymptomatic is that ang mga symptomatic ay nagpapakita ng mga sintomas na sila ay may sakit or infected. While asymptomatic means that they are sick but does not develop signs or symptoms that they are sick. Infected persons can be contagious even if they show or they don't show symptoms. The virus can transmit from them to others directly or indirectly.
Anak, bakit ka ubo ng ubo? Ang init mo ah. Ayan na nga ba sinasabi ko eh. Pinapatulog ko kasi kayo, labas kayo ng labas. Paano kung COVID yan? Ay nako.
Mama, nung Monday pa po yun eh.
Kahit na.
Sorry po.
Hindi ko alam pag may nangyaring masama sa inyong dalawa. Halika, doon muna tayo sa kabila. Doon ka muna matulog. Gumiwalay ka muna sa ate mo, okay?
According to Healthline.com, that is medical reviewed by Michaela Murphy, PAC, and is written by Erica Hirsch and Jill Saladi-Shulman, PhD. Ang incubation period ng coronavirus ay between 2 to 14 days. Maaring lumabas ang mga simptomas in 5 days after ma-expose sa COVID-19 or sa infected person. Pero, it may vary depending on the infected person.
Ate, gusto mong lollipop? Ito.
Sige.
Arlene! Di ba sinasabi ko huwag ka lalapit sa ate mo? Paano kung maawa ka? Napakakulit mo talaga no? Gusto mo paluin kita, ha?
Ayaw, Mama. Binibigyan ko lang naman po ng lollipop si ate. Kasi kawawa naman siya.
Anak, inaalagaan ko ang ate mo. Paano kung COVID yan? Eh di nahawa ka pa. Kaya naman please, anak, please. Huwag ka muna lumapit sa ate mo para hindi ka na mahawa, okay? Please, anak, nagmamakaawa ako. Huwag ka muna lalapit sa ate mo.
Opo.
Mama, walang lasa yung candy.
According to World Health Organization, ang mga simptomas ng COVID-19 virus depending on the level of severity from mild to serious illness. Maaaring makuha ang most common symptoms, less common symptoms, o serious symptoms. Ang mga halimbawa ng most common symptoms ay lagnat, ubo, pagkapagod, at pagkawala ng panlasa at panamoy. Para sa less common symptoms, some examples would be sore throat, pananakit ng ulo, body pains or aches, diarrhea, fingers or toes discoloration, rash on skin, and irritated eyes. Lastly, serious symptoms may be chest pain, shortness of breath or difficulty breathing, loss of speech or mobility, and confusion. Seek medical attention as soon as possible kapag nakaranas ng mga serious symptoms. People with mild symptoms who are otherwise healthy ay maaaring magpagaling sa sarili-sarili nilang bahay.
Anak, halika, magpa-araw ka.
Hindi lahat ng naiisip natin gawin ay makatulong sa pagpapagaling ng COVID-19. Antibiotics cannot prevent or treat COVID-19. It works only against bacteria, not viruses. COVID-19 is caused by a virus, and therefore antibiotics should not be used for prevention or treatment. Some people who become ill with COVID-19 can also develop a bacterial infection as a complication. In this case, antibiotics may be recommended by a healthcare provider. Adding pepper to your soup or other meals does not prevent or cure COVID-19. Drinking alcohol does not protect you against COVID-19, and it can be dangerous to your health. Vitamin and mineral supplements cannot cure COVID-19. Micronutrients such as vitamins D, C, and zinc are critical for a well-functioning immune system and play a vital role in promoting health and nutritional well-being. There is currently no guidance on the use of micronutrient supplements as treatment of COVID-19. Using Vicks VapoRub on your chest or on a vaporizer may soothe your symptoms but will not cure you from the infection of COVID-19 virus. Exposing yourself to the sun or temperatures higher than 25 degrees Celsius does not protect you from COVID-19. You can catch COVID-19 no matter how sunny or hot the weather is.
Ano ba yan? Ilang araw nang niyalagnat ate mo. Teka. Teka lang ha.
Hello po, tita.
Hello, Neng. Oo. Hera, kasi Tin, 3 araw nang inuubos sipon, niyalagnat, tapos walang panlasa daw siya, tsaka hinang-hina na.
Ay, naku, tita. Vaccinated po ba yung mga bata?
Naku, hindi.
Eh, sige, tita. Ganito na lang po. Ipa-antigen test niyo po sila para po malaman natin kung may COVID po ba sila or wala. Yun nga lang po, hindi po masyadong accurate results nun, kaya po kailangan pa pong ulitin. Hindi po kasi kami makakapunta ni Gab dyan kasi po pareho pong masama yung pakiramdam namin.
Eh, paano ba yun?
Para sigurado po tayo, tita, mag-PCR test na lang po tayo. Medyo may kamahalan nga lang po, pero mas accurate po yung result nun. Meron po home service kaya hindi nyo na po kailangan lumabas ng bahay.
Sige, yun na lang. Kung titingin-tingin na lang ako. Salamat.
Antigen tests are less accurate than PCR tests, but they are generally good at detecting the virus. In most cases, when a person with symptoms has a positive antigen test, they have the virus. However, antigen tests can be positive even if the person does not have the virus, which is called false positive. In this case, a provider may recommend a follow-up PCR test to confirm if a person has the virus. While it is possible for a person infected with COVID-19 to falsely have a negative antigen test or false negative, especially when the procedures are not done properly. Both antigen and PCR tests can show if a person has COVID-19. Antigen tests can give results rapidly, often within minutes. PCR tests take more time to perform, but they are on average more accurate at detecting COVID-19 than antigen tests. However, there are also scenarios wherein PCR test results are also false positive. Your healthcare provider or testing site staff will decide which test to use. They will also decide what kind of follow-up test to use if needed.
Tita, kumusta naman po? Si Tin lang po ba yung masama yung pakiramdam?
Oo si Tin lang ang masama ang pakiramdam sa amin. Si Early naman, okay naman. Yun nga lang, pinapalayo ko lagi sa kapatid niya. Tapos ito nga, lagi kaming naka-face mask. Ako naman, okay naman ako. Yun nga lang, lahat ng ginagamit namin is lagi nakahiwalay. Yun nga, nakakapagod.
Oo nga po, tita.
Para po sigurado, tatlo na lang po kayo magpa-test kasi posible po na yung isa sa inyo po is asymptomatic.
Sige, sige.
Okay po, tita. Tapos wag po natin kalimutan bigyan po siya ng biogesic. Tapos punas-punasan po natin yung katawan niya para po bumaba yung lagnat niya. Eat healthy foods po. Inom po tayo ng gamot na vitamin C pang pagkakas po na immune system. May iba pa po ba nararamdaman si Tin? Chest pain, hindi po siya makahinga.
Hindi naman, anak.
Ayun po muna pala sa ngayon, tita. Saka po, huwag niyo pong gamitin yung mga ginagamit niyang gamit. Si Erlyn po, pag wash niyo po lagi ng hands, saka pag gamitin ng alcohol, at huwag niyo po muna siyang palapitin kay Tim.
Oo nga. Napakakulit ng batang yon. Siyempre, namimiss yung kapatid niya. Salamat, Iha. Salamat.
You're welcome po.
Si Christine lang ang nag-positive sa ating tatlo. Anak, dito ka lang muna lagi, ha? Huwag na huwag ka muna lalapit sa ate mo para hindi ka na mahawa pa, okay?
Opo, mama.
So bakit nga ba hindi lahat ng magkasama sa bahay nahahawa? According to recent research published by Imperial College London, people with larger levels of T cells, a kind of immune cell from common cold coronaviruses, were less likely to become infected with SARS-CoV-2. Coronavirus is a broad term that contains a wide range of viruses, including the one that causes COVID-19. The virus family of COVID-19 is responsible for many of the typical colds we see. According to the findings, memory T cells produced by these viruses may explain why some people test negative for COVID-19, despite living with someone who has tested positive. Given the fact that different coronaviruses cause various illnesses and behave distinctly, they all share some characteristics that place them in the same family. Immune cells that recognize one type of coronavirus can recognize another because of their structural similarity.
Tita!
Nak, si Tin lang ang nag-positive sa amin.
Sige po, mabuti naman po. Bali, tita, continuous lang po yung mga sinabi ko sa inyo dati, tas 14 days po. After 14 days po, kapag hindi na po nakikitaan ng kung ano-anong symptoms si Tin, mas mabuti pong i-disinfect po muna natin yung gamit niya para sure po.
Sige, salamat, Iha. Salamat. Inom ka muna ng gamot, ha?
After 14 days of quarantine, Christine is already free from sickness and symptoms of COVID-19. According to Johns Hopkins Medicine 2022, COVID-19 patients who have a mild case normally recovers in 1 to 2 weeks. Recovery from severe cases can take 6 weeks or longer, and some people may experience long-term effects, including damage to the heart, kidneys, lungs, and brain. However, reinfection is possible, and the best protection is to get fully vaccinated and receive a booster when eligible. And of course, observe COVID-19 protocols.
Hera, kamusta kayo? Magaling na ba kayo?
Ay, opo, tita. Tapos na po kasi yung 14 days po namin. And after po no, nagpa-antigen po kami. Negative na po yun. Kaya medyo masiga na po sigag ngayon.
Hi tita, I'm already alive and kicking.
Ay, mabuti naman. Kami rin, okay na rin kami. Nagpa-swab na rin ako nung isang araw. Negative na rin. Nakapag-disinfect na rin ako dito.
So, tita, kailan po kami pwede pumunta dyan para pumaturuan po namin kayo? Saka yung mga bata ng mga precautionary methods, saka po yung tamang paghugas ng kamay.
Ay, ining anytime. Nakapaglinis naman na ako dito eh. Pare-parehas na tayong okay na.
Ay, sige po, tita.
proper hand washing with water and soap for 20 seconds, it is important to not have a COVID-19. It is important to make sure that your hands are clean before touching your eyes, nose, or mouth, after touching your mask, after leaving a public place, and after touching objects or surfaces that may be frequently touched by other people, such as door handles, tables, gas pumps, shopping carts, or electronic cashier registers or screens. If soap and water is not available, alcohol and hand sanitizer with at least 40 to 60% alcohol will do.
Ay, hi tita! Oh, ito po tito, may mga dala po kong pagkain. Meron po ibang fruits, saka po mga sumang. Para po sa inyo sa mga bata po. Opo, tita.
Ay, naku, salamat naman.
At tita, ipabaksin nyo na din po sila. Kung magpapabaksin man po kayo, siguraduhin nyo pong wala na pong symptoms or signs or symptoms na may COVID po sila. So, according po sa CDC or Center for Disease Prevention and Control, dapat po after po nila magkasakit, tapos after pong mawagan na ng symptoms, 10 days after that po, saka lang po kayo pwedeng magkaroon ng or kumuha ng vaccine.
Natakot kasi ako, mga bata pa sila.
Ay, tita, hindi. Pwede na po kasi po, yung vaccine po, protection po nila yun against sa virus. Pero kung di naman po kayo nakakasigurado, mas mabuti po siguro kung itanong nyo din po yung pediatrician nila.
Sige, dahil ikaw nagsabi, papaskid na natin yan.
They are not 100% efficient in avoiding infection, and the immunity they confer wears off with time. And the Omicron variant has weakened it slightly. There are different vaccines available for COVID-19, such as Pfizer, Moderna, AstraZeneca, Janssen, and Sinovac. There are other vaccines available, but only these are available and trusted in the Philippines. Vaccines against COVID-19 have been shown to prevent severe infections, hospitalizations, and fatalities, and they are still mainly effective against known viral strains.
Eh, tita nga pala, asan po yung mga chikiting?
Ay, teka lang ha. Erlyn, Tin! Nandito na ate kabadate hera nyo.
Hi, ate!
Hi, ate!
Tuturuan niyo na po kami maghugas ng kamay.
Ito, sinita ka na!
Yay!
So guys, ito maghugas ng kamay ha. Oh, wait lang. Lagay tayo sa bowl. Tapos, ayan. Para maghugas kayo, hindi dapat minamadali. So, dapat mga 20 seconds. So, kung gusto niyo naman, maging masaya yung paghuhugas nyo ng kamay, kanta lang kayo ng birthday. So, kasi saktong 20 seconds yon. Hindi dapat siya minamadali. So, para maghugas kayo, ayan, huwag na kalimutan yung mga kuko nyo, yung fingers, okay? Tapos yung palms ng hands. Ayun, good. Sugat.
Ganito po.
Tama, very good.
When wearing a medical mask, make sure it fits properly. Do not reuse a disposable mask, and always change it as soon as it gets damp. Clean your hands before you put your masks on, as well as before and after you take it off. Taking care of ourselves is necessary to make our immune system strong in order to be able to fight the virus which attacks our respiratory system and other organs. Make sure to have enough sleep, eat nutritious foods, especially those that are rich in vitamin C to boost immunity. Regular exercise is also important to make our bodies strong. In doing outdoor exercises, of course, don't forget to wear your face masks properly. Maintain social distancing and don't forget to enjoy life responsibly. Let's jog!